So here we are looking at the chart that I promised you, and you can see that in 2011, which has already passed, but the top number would have been 18,000 for Medicare, and then 2012 it goes to 12, 8, 4, and 2 to get a total of $44,000 over the time span. Medicaid, however, would have started you out at $21,250 and would have decreased you to $8,500 a year until 2016 to total you out at $63,750. So very nice. Well, we're not in 2011 anymore. We are in 2012, but look what happens. The same thing holds firm. So very generous to keep that amount of dollar availability there for you 2 years running. But if you notice into 2013, then you're taking a hit if you're a Medicare provider. You'll get $15,000 the first year, and then ultimately over the 4-year period, you will accrue the $39,000. However, the Medicaid providers will stay the same. In 2014, which is the last year a provider can qualify under Medicare, you will see that you're going to qualify for 3 payments in 2014, 15, and 16 if you continue to use EHR, and your total money would equal $24,000. So the difference between hopping on board this year and waiting to the last minute is at minimum $20,000. And if you wait too late into 2014 and cannot qualify with your full requirement of 2014, then you're into 2015 and you've lost any hope of a Medicare incentive at all. If you look on over into 2016, Medicaid is allowing you to qualify for the first time as late as 2016, so that's very nice. Your payments extending down to 2021. And you still get the full amount of $63,750. So very nice for you docs who are working hard for the Medicaid program. They are really, really rewarding you on this one. The Medicaid docs also working hard for the Medicare program, but they're not being quite as nice to you. So we need to get you guys on board and rolling before it's too late. That way you can take advantage of all of the incentive dollars, and you won't have a problem qualifying and paying for your EHR. Keep in mind that if you see Medicare and Medicaid patients, and perhaps you could qualify under both programs, you can't. You cannot draw simultaneously under both programs, so you would have to choose which program to go with on a given year. So just to let you know that, in case you were thinking, wow, I can get over $100,000 over the time span, they're going to stop you in your tracks there. So you do have to pick a program. But nevertheless, good incentives for whichever program you're able to choose. So next, let's talk about some of the meaningful use measures that you're going to have to meet. First of all, it's worthy for you to know that you have to prove meaningful use of your EHR for at least 90 continuous days the first year that you implement, and then continually 12 months on each year after until they stop looking at you. So the first year you cannot qualify for your money unless you show 90 days. So what does that mean for you? That means if you do not implement before September of this year, chances are you're not going to be able to demonstrate 90 consecutive days of meaningful use. So the next 6 months are going to be big decision-making time for a lot of providers, because this is something that has to take place to give you and your staffers time to get control of your EHR system well enough to meet the meaningful use measures, so that September, October, November, December, that time frame can be that continuous 90 days that you utilize to get your money for 2012. It would be a real shame to implement in September and then not get a control on it until October or November. At that point, you don't have 90 days left in the year. So you really need to get that going as early in the year as possible. And the busier and bigger your clinic is, the more urgent that is, of course, because you have a lot more to implement. Now, physicians are going to have to prove that they have met 20 of 25 different functional objectives, and then 6 clinical quality measures with the use of their EHR product. And this is going to be what demonstrates, meaningful use to CMS. So these objectives are going to include things like computerized physician order entry, the use of your clinical decision alerts. We'll talk more about this in a minute. Incorporating lab results that you can bring into your system through the wire, so to speak, as discrete data. E-prescribing, which a lot of you are already doing, and of course electronic information distribution to your patients. Super important that they're implementing more and more of how you communicate with your patient electronically. So that's going to be a very important part of your EHR meaningful use. Physicians are going to be paid as soon as they meet meaningful use on a rolling basis. So your first straight up 90 days, you'll get all that submitted. We're hearing anywhere as early as 2 weeks to 2 months, the checks are being cut after a doctor sends in their meaningful use proof. So that's wonderful. You want to get those checks cut as soon as possible.